yalon ko fana ya ado ni chosano lang bari man fin kankuran wala manyo bito hani fa kaseboyo nta kadi ture mbina lalije ka kuwal natale mungu ka ado ni chosano la kuwala aninga men talent tv ado ni chosano tamabulale koteke albulan noma kona fale nyame arabo arabalo ado ni chosano aninte ture muso fenta mabula koteke
for coming. As usual, the Honorable Minister updates the public on the situation of COVID-19 in the Gambia. So we'll also invite him to come and give an update for today, the 6th of April 2020. Honorable, you're most welcome. Thank you very much. You can put the button here. Well, no, I don't. Good afternoon, ladies and gentlemen. Thank you for coming for the daily updates on COVID-19 response in the Gambia. Today marks the 17th National Situation Report since the confirmation of the novel coronavirus disease, COVID-19, in the Gambia on the 17th March 2020. We are happy to indicate that the situation is still stable, with no positive tests detected since the last one on the 26th March 2020, which was also the 4th case. The current case we have is doing well at the treatment center. There is currently one probable case who's awaiting repeat testing for confirmation. So far, we have conducted a total of 137 laboratory tests. There are at present 37 people in quarantine. The surveillance activities continue. We still maintain that we should not be complacent because many countries who currently have thousands of confirmed cases were in the same position 3 to 4 weeks ago as we are today. We are in the process of acquiring various equipment and supplies for strengthening the health facilities to respond to the COVID-19 and beyond. We hope to receive this equipment in the coming days. We should endeavor to practice social distancing and continue our prevention strategies, such as hand washing. We should maintain the etiquettes of coughing and sneezing and stay at home when we do not have to be outside. We should also support the security forces at the various points of entry, both official and non-official, to ensure the border closure to prevent us from getting infected cases traveling across the borders into the Gambia. We thank you very much for your kind attention. Now we will invite question and answer to be moderated by Sankano, and then he will just take a few questions, and then the Minister will respond. Sankano, you can facilitate. Thank you very much. Yeah. Can you answer your name and your media organization? Citizen File from the Gambia Times. Gambia lulu soto mimbe tamakang mimbe public loptanol Gambia lulu soto barika fo ventilators ni mola sasa jawiyata fo abike ni jino afaye ni jokole atabulu eka o pipe dunda kan kono yake o masingo bala masingo le kala ni jota mandi aka gaso diala bari o masin dol besilo kan inshallah sambi jamal be futala ando ni futata albe mbal killale pour aliena etandi molla wol kono ventilators be je ka fo masingo le ventilator wol kono masin jama be je mi alon ko ning mola sasa be tembo minto ala ni jobe nyamin aji soka pompi nyamin wol be masingol min ke fintindi wol fanam beje masingol mi ya lonko e ka boro pompi balo kono domandin wol be kono wo mo sifal min na sasa jawyade ke la dulal min jo laran sifal min kay chamaje wol ba kono borol fanan ba kono ñing minin ka mol fanan ka ke numoto ka fo mi masque pour sasa kana duila warana be to la kana sawon wol fanan ba kono ñing mol ka fangol min fanan dum ñing personal protective equipment wol fanan jamabe je mi alon ko do kulal ke dum pour alal de maroto setanka wol fanan ba kono ambulance jamal fanan ba kono mi alon ko special ambulance sol dem pour kanyim molu samba yon lab machine jamal fanan ba kono mi alon ko bina x-ray machine ba kono ñin digital x-ray so ñimmo aketa Gambia fane opportunity ti ñing mako rol min bina pour que bagasol ñin mi alon ko bagasol mi alon ko na loptanol me soto kotoke pour que loptanol bambandi pour se ñing courant ka respondo ni responta wol kola o bagasol betula ñin loptanol leto wol ba sabula ko ñin loptanol fana alal de maroto sembo be warla pour que continuer ka jararo ke ñin banko ka hani ni sasa tambirin kola.
Questions? If there are none, then okay.
Just one question I want to ask. I was talking to somebody who told me the minister says they need $150 million to do like an aggressive testing, random testing of everyone. So I don't know how is the ministry doing that, because most of the countries that contain COVID, they did like a lot of testing. I don't know whether it is part of your plan to do aggressive testing to know so that we can be sure that we don't have.
Yeah, I'm not sure about the figures that you mentioned. I'm not aware of that officially. But what we can say is that we look at various criteria for us to do testing. I am not aware of any country that is testing all the citizens. And of course, testing also costs money. So you want to be cost effective when you carry out specific interventions. But we are testing the people who have undergone quarantine and is continuing still. Our people are testing, they are very active. We're testing the contacts, to some extent the contacts of the contacts. The high-risk people are being tested, and we will increase that. But sometimes people also speculate that Gambia is not doing enough testing. But if you look at what is happening, if Gambia is not doing enough testing, then that means we would have been seeing people who are sick and they are not being tested. But are we seeing those? We are not. You understand? That would have been an indicator as to the adequacy of the test, or at least a rough gauge. But we are not seeing that. Fortunately, we thank the Almighty Allah, we are also not seeing people who are succumbing to symptoms that are similar to COVID. So that means that would have been a rough indicator as to, a rough indication as to under testing. I hope you follow the argument. If we are not getting people who are getting very sick and then coming to the hospitals and we test them, they are positive, and we are not getting mortalities, that means really the strategies our people are using are adequate. We are not saying we are not going to increase the level of testing based on certain factors, but you don't go around, just seeing anybody and start testing, because the resources are also important. In as much as it looks trivial, it looks small, but cumulatively it could amount to a lot, and then some of the tests probably might be thought to be unnecessary. So there are guidelines as to when and when not to test and so on and so forth. So we are following that. But I'm not saying this cannot be escalated. When it comes to COVID-19, things change very rapidly. What could be the reality today, in the next few hours could change. That we've seen it in other countries. But we pray that our situation stays calm.
One last question.
It's more like a follow-up. Good afternoon. I am Aisha Tijal from Gambian Talent TV. Honorable Minister, what is the Ministry's budget to fight COVID-19? Because a few days ago we have seen that the President allocated 500 million, and you made mention in one press conference that it's going to be for PPEs to compensate health workers and other stuff. Just recently we have seen another money from the IMF. So we want to know what is the amount that the ministry is allocating to budget for these COVID-19. Are all that going to those materials? Because we have seen other donors also donating those materials as well.
Yeah, so unfortunately, a few days ago when we spoke about that, sometime last week, when it came on TV, QTV, they only mentioned PPEs and the sensitization, and they cut it there. So all the host of things that we said with regards to what the money is going to be spent on were not shown. So I thought they should have endeavored to show and everything we said, which is not even exhaustive. But you see, when it comes to emergency response, you heard we said we are going to buy the ventilators, we are going to buy the personal protective equipment, we are going to buy the infusion pumps, we are going to buy the monitors, we are going to buy the ambulances. A lot of ambulances, you'll see a lot of ambulances running around. We also we bought some utility vehicles for people to be able to move around. We're buying ICU beds. We are also buying other hospital beds. We are buying X-ray equipment, digital X-ray machines for many of our facilities. We are buying laboratory equipment for the labs and the consumables. So a whole lot is going to be bought from these monies. That's now when it comes again to the budget. I did tell you people some time ago that when the planning was being done, the various units under the emergency committee came up with their budgets, and it was all compiled, and it became 8.8 million, a little over 8.8 million US dollars. Now this was presented to the partners. Fortunately, World Bank took it upon itself, and then they now have agreed to fund that. And in fact, World Bank is the one actually helping to procure this equipment, that are under the World Bank lot. So a lot of these equipment that are going to be procured are under the World Bank lot. In the process, the government also declared that they are going to sponsor, provide $500 million for the COVID-19 response. Now, part of that money is also going to be used to buy more equipment for our health facilities. I think this is a unique opportunity to put in all our health facilities equipment that we are lacking, so that they are able to deal with COVID-19, and thereafter they are able to deal with other diseases. So the health system is going to be strengthened. The health facilities are going to be renovated. The health facilities are going to be upgraded. That's all part of these funds. Now, as part of the World Bank support also, World Bank is constructing for us what we call an emergency or an infectious disease treatment center. The Ministry of Lands has already allocated that land, and is going to be a state-of-the-art infectious disease treatment center somewhere, around Brusubi there. Land has been allocated already. That's also going to be built out of this. And then other treatment centers are going to be built from these funds, and initially, because we want to do some of them fast, so that just in case there is increase in the number of cases. So the temporary structures will be built very soon. Thereafter, in fact, in parallel, we're going to have some more permanent structures. But of course, the media sensitization programs are also part of this engagement of the population, and the procurement of the sanitary materials. The buckets here and there, the sanitizers, the soaps, the bleach, and so on and so forth. So everything about COVID-19 is in these funds. Now, it doesn't stop there, because other players also participate in the COVID-19 activities. The police have already submitted their budget, and the police for their activities, the patrol, the making people also follow the rules that have been set in this emergency time. All those things, and the police also in their budget have put in the need for vehicles to be able to patrol the borders and so on and so forth. All that is going to be part of this 500 million. Now, in addition to that, the Ministry of Education, you know, they are doing some educational programs on the TV, which cost a lot of money, run into millions. That's also going to be removed from this 500 million. So this 500 million is the government's response. So in addition to that, of course, the frontliners, I repeat, only the frontliners are going to be given allowances from this to be able to compensate them a little bit. So this is the summary. But this will all be brought together and it will be made open to the media and to the general public at regular intervals. Now, it's also important for us to tell you that these funds have not been lifted and given to Ministry of Health. Government has a process. So when requests come to the Ministry of Health or within the Ministry of Health, the requests go to the Permanent Secretary. Then the Permanent Secretary shows the Minister. When the Minister looks at it, and then it then goes to where? It goes to a committee. There is a committee that looks at these things. The committee is an ad hoc committee that has been set up within this period to look at the management of these funds. Now, what that means is that whatever request comes, they scrutinize it. So it's not a one-person show. It's not a one-person show that one person will come and approve this and then it is done. Now the committee has the Permanent Secretary, Minister of Health and his team, Permanent Secretary, Minister of Finance and his team, the Accountant General, Director of Internal Audit and Director General of GPPA. So they look at this. Why did we set this committee up? So that they can look at each other. They can contribute positively, so that they can also support each other in the sense of maintaining the rules and the regulations that guide the financial expenditure of the government. But equally speaking, so that they can do the processes quickly, because this is an emergency. Things need to be done quickly. Ordinarily, these documents would have had to pass over to various people before approval, and it would have taken a lot more time. Now, it also enhances that there is accountability, and the transparency at the high level. Now, Ministry of Finance would know what Ministry of Health is doing. Ministry of Health will know what Ministry of Finance is doing. So the Director of Internal Audit will know what is happening. The Accountant General, now when he is disbursing, he would have gotten approval from this committee. So it's a very robust system, and the GPPA Director General will know that this procurement is going along the lines that are along the rules that are laid down. So this actually is a robust system. Now, these funds of the 500 million, a special account had been opened for it. It is called a Special Projects Account, and the account is in the central bank. So when these processes are done and then approval is given, then these are sent for the Accountant General to make these payments, and the checks are signed by them. So I think this is a simple process. The last time you also saw on the social media a document with regards to allowances. I'm sure you want to ask about that too. Yeah, so that was put forward by certain individuals, in the ministry, but unfortunately a lot of names were included that shouldn't have been there. And unfortunately, equally, that was circulated without my knowledge. I didn't see that. But we made that clear. But the point was that it wasn't approved. The idea was to take it to the approving body. So, but the approving body certainly wouldn't approve of such. Our Permanent Secretary was there, that of Finance was there, and the other people were there, and they all flatly rejected it, which is good. So yes, people will try to bring in all kinds of budgets, but it is left for the authorities to scrutinize and make sense out of it and decide to approve or disapprove. So those safeguards are all there. Now, that specific account It is open and it is out of the mainstream ministry's mainstream account. So at regular intervals, at the click of the button, one will see all the expenditure, all the money that has come in and all the expenditure from that account, and we will share it. We'll be sharing it with all of you because it's a transparent process, it's an open process, and the people of this country will know what is being spent. In addition, the donations that also come, what the permanent secretary does is that he sends them to the donors to pay these monies into that particular account, and they come up with their slip, their payment slips, and they present that, and then that is what is received, and the donors are thanked. At regular intervals too, those donations will all be listed, whether it is in cash or kind, and it will be published for all to see. Thank you. Okay, let her follow up.
Okay, you made mention of the media.
Yeah.
And is there any media house that you are given a certain amount to broadcast your programs also? And the last time you made mention of facilitating PPEs for the media, but we are still yet to receive that. And considering how vulnerable we are still in the front line, I think if you can help to facilitate that as early as possible, we will be grateful.
Yeah, so for the media houses, I mean, I think you have a body that coordinates your activities. So come together and make the request to the permanent secretary. You have to request for these things by yourself. Otherwise, you cannot be issued with what you have not requested for, isn't it? So you make that request so that you also get the PPEs. The media, of course, your veteran communicators are here. They coordinate that, and they've been engaging the media houses. I'm surprised that you didn't know that, but they've been engaging the media houses to make sure that they run programs on the media houses and so on and so forth. Of course, we thank the media houses in the sense that quite a number of them also, provided free airtime for this COVID fight. So it's probably that is the donation of the media houses to the fight against the COVID. But of course, they are now engaging the traditional communicators, the Kanyalangs. They are also engaging the various other people who could have clips that need to be shown. The process is continuing, and so they will continue to engage with all of you for your contributions.
Thank you very much, Honorable Minister Dr. Samateh, for that elaborate explanation on the checks and balances in place, in ensuring that the national response to COVID-19 is transparent and accountable to everyone. And for the media, as you said, we've been engaging the media. You have a body. We ask them to put something in writing for us to look at it. On that note, Director, if you have anything to add before we can wrap up today.
Honorable really said a lot about
Yeah, go on. Yeah, go. Start.
Thank you, Honorable. That was a very brilliant statement, and also the response with regards to the media. What we as he said, we have to thank all the media houses for providing free airtime, and some of you have been running after us, asking for us to come, and then definitely we've been trying our best to at least to fulfill our promises to reach you, and we are able to reach almost all of you. So that is, we have to thank you very much, and that's also part of your contribution. In addition to that, we are also working with our partners like IOM and also FAO. What we are now doing is we want to have a synchronized broadcasting, where you'll be seeing 2 or 3 ministers or 2 or 3 permanent secretaries on a daily basis, and we are also trying to finalize the documentation, and now FAO is going to take up that responsibility, and then almost all the media houses will be given at least a bit of support. We also requested to IOM for them to at least give you support, because you have been helping us at a time where we don't have resources, and they've also agreed, and they're also looking internally to see how because all of you are going to be supported according to what they said, but they're also trying to look at what internally what they can do. And as you know, the UN bodies, what they did was they have what they call the RCCE, that is a Risk Communication and Community Engagement Committee, which is headed by UNICEF. So UNICEF also coordinates all these UN bodies in terms of their communication. So we are also in touch with UNICEF in that area with our subcommittee. So we have been pushing very hard for you people to be supported in terms of either finance or training. We're also linking some of the organization to you people, so that if there's any capacity building, you can also be identified to be trained. So we are doing a lot of support for you, and we will continue with the support of the minister. We'll continue because he has already been asking, what are you doing for the media? What support are you? So we will definitely try to see that you are also supported up to the time that at least, because we know you have been there for us at a time where we don't have resources. So even when resources are available, you'll be supported. And we're also going to provide some partners to you to support you along the way. Thank you very much.
Good. On that note, we wrap up today's,
Aka kenu nyamen ñiram programme to mum bina la Gambian Talents TV araba ka bo talent nani foka jitala luluka min ko aka kenu nyamen ni ado ni ciosano le fere min ko ado ni ciosano akita ko mi yanu ka ma bo tele nañu jamano molo mu yalon ko fan ya ado ni ciosano lam baake molo mu yalon ko fana ya ado ni ciosano lam bari man fin kankuran wala maño bito hani fa kase boyo ntaka di touré mbina la liji ko pol natale mungu buka